In this time of a pandemic, perhaps no industry is changing as quickly as healthcare. In our next session, we hear from Dr. David Rue, Chief Medical Officer and VP of Healthcare at Microsoft, Ashima Gupta, Director of Global Healthcare Solutions at Google Cloud, and Rob Coppedge, CEO of Echo Health Ventures. Before we hop into this session, let's hear from Health Tech Stage sponsor, Regence Blue Shield.
Hello, my name is Brady Cast. I'm with Regence Blue Shield. We've been a proud sponsor of the Health Tech Stage at this year's GeekWire SUMMIT, and what an event it has been. Our goal this year has been pretty simple: to engage in transformative conversation around the vital innovation economy here in Washington State and throughout the Pacific Northwest. The healthcare industry has long been a critical part of Washington's economy, but at this year's summit, the Regence Health Tech Stage took on a whole new importance because innovative and effective healthcare is even more critical for all of us living in the midst of a global pandemic. At Regence, we're excited to continue our partnership with GeekWire to offer health plans tailor-made for tech companies through the All Tech Benefits Trust. We've made it our priority to support our members, employers, business partners, and local communities through the public health crisis. To learn more about All Tech, contact your agent or broker for more information. Over the last 3 weeks, the Regence Health Tech Stage has delved into the progress made in the race for a COVID-19 vaccine and what the data tells us about how to best fight the disease. We've also had experts talk about the explosion of telehealth solutions during the pandemic and how that's impacting patient care for the better. We've learned more about life sciences and finally how venture capitalists see the intersection between health and technology. It has been quite an event, and we hope you've enjoyed the Regence Health Tech Stage at the 2020 GeekWire Summit.
Thanks, Brady, and thanks again to Regence for your support of the GeekWire Summit. And now I'd like to toss it over to Aaron Broadwin, health reporter at STAT, who will lead us into our next session.
Hi, everyone. Thanks for joining us to talk about the sea change that is coming for healthcare. Today, I'm pleased to be joined by David Rue, Chief Medical Officer and Vice President of Healthcare for Microsoft, Ashima Gupta, Director of Global Healthcare Solutions for Google Cloud, and Rob Coppedge, CEO of Echo Health Ventures. So I'd like to start with you, Ashima. I think everybody here is probably familiar with Google, having used the platform about 7 times already in the past 10, 15 minutes. But I wonder if people are equally familiar with its cloud business. And I want to start with a little piece of news. I saw that over the summer, you invested $100 million in the major telehealth provider, Amwell, which conducts virtual visits over people's phones and laptops. And I wonder, what is the aim of that partnership?
Thank you, Erin. This is a good question. And you're right, most people know Google as a consumer company, and we've been working for past 2 decades in building consumer products like Gmail, Search, YouTube, Google Maps, etc. We're very proud of that consumer portfolio. And Google Cloud provides enterprises, organizations around the globe, scalable infrastructure, platform capabilities, and industry solutions, the one that we are building for healthcare industry. And healthcare, as you know, is a multifaceted industry, and we are proud to be working in many different angles. So we have Verily that mostly focuses on life sciences. We have Google Health, where a lot of our clinician tools and AI research comes from. So multiple ways Alphabet set of companies are looking into helping multiple different facets from healthcare perspective. Talking about Amwell, so this is a cloud partnership. As I was mentioning before, cloud is about building helpful tools for the healthcare industry. And during COVID, as we were recalibrating our solution and product portfolio, telehealth came out as one of the themes as we were listening and talking to our customers. And we constantly look into build by partner as you're looking into having a portfolio approach. And we also saw that our customers are having this bimodal strategy. Like first is present forward. How do you act now? What tools are available today? And overnight, many hospital systems spun up many telehealth solutions to scale. And And that was to meet the demand for COVID-19 during lockdown and sheltered in place. But also the multimodal or the bimodal strategy is also future back. Like, how would they want to navigate in the new normal? And that's where in the future back, the telehealth became one of the angle where there's a need for enterprise infrastructure grade, the enterprise grade infrastructure that's secure, but also has the capabilities of telehealth applications. So, Amwell, we are incredibly proud of our partnership. The way we are thinking about it is first is the scaling the infrastructure, scaling the new need for the new normal, right? That part of the future back strategy. The second is we have capabilities in AI and machine learning. Google is an AI first company. So capabilities like conversational AI. We have, during COVID, saw chatbots, rapid response virtual agents that are multilingual, that can have the conversation. The second is around natural language processing and medically tuned. And so the way we are envisioning is we will bring AI and machine learning to Amwell's telehealth platform, and together it's very complementary in how we see telehealth experience being augmented by these technologies. So pretty exciting that telehealth will be not just another modality, but very connected healthcare experience in the future. So when you imagine that future, think of multilingual conversational agents with interacting with patient and provider and translating. Like if my patient is speaking Spanish, the doctor speaks English, can we make it any better? So that's the vision in terms of bringing AI and machine learning capabilities. And Amwell has the platform and they have the ecosystem, right? They are already part of many different hospital systems and players. So time to market was important. They were a clear category leader, so it became a very good match. So again, it goes back to building and bringing helpful tools to the industry. It is the Google Cloud's mission overall.
Got it. That makes a lot of sense. Thanks for that. I'm also realizing that as I rushed right into this session, I forgot to introduce myself. In case you didn't read the little helpful background here, I'm Erin Broadwin. I'm a health tech reporter with Stat News. So I think let's go to David next. David, as I understand it, Microsoft has increasingly been beefing up its work with health systems, not unlike Google. And you have a COVID response initiative that I believe started with the hospital network Providence. I'd love to hear a little bit more about that.
Yep. So thanks a lot, Erin, for having me. So by way of background, I'm the Chief Medical Officer for Microsoft for the worldwide commercial business. I'm also an infectious disease doc. So I trained during the AIDS epidemic, and it's been really strange for me to have to sort of relive some of the elements of that epidemic in some ways that are quite similar, but also quite different. One of the things that is similar and is certainly the fact that it's impacted so many people. It's something that many of us have had to rally around to try to figure out ways to address the acute needs and also to figure out ways that we can prevent it from spreading. But we also have seen that this is something that's required a coordinated response. And so as part of that response, when COVID first hit the United States, it happened, one of the key areas was in the Kirkland nursing home area, and in particular near Seattle, which is, as you mentioned, not only close to Providence, but also close to Microsoft's offices. And given that Providence is one of our strategic partners, many of the things that they were involved in, we were also involved in. The first thing that they recognized was that the number of people calling and having questions and concerns about whether they had COVID was overwhelming the health system. People were coming into the ERs and urgent care, and the phone lines were jammed, so they couldn't really get through, and people were panicky. That in itself created a major issue because you were exposing potentially folks who were not infected with those who could potentially be infectious. And so one of the things we realized is that information exchange on a large scale basis would need to occur. And as we've seen now over the past several months, the use of AI-based chatbots reconfigured to address COVID has served as an extraordinarily powerful tool. In fact, we saw almost an immediate reduction in call volumes by about 30%, where in fact, there was a subsequent decrease in terms of foot traffic to ERs and urgent cares. And that allowed hospitals to be able to regroup and be able to deploy their resources more efficiently. And what we also saw was that it was served as a great vehicle to handle things virtually. So if you were on the AI-based chatbot, and it could be done on a mobile phone, it could be on a website, you could actually then have a natural handoff to a telemedicine visit, which is something that we realized was an important next step. And so as part of this, just to give you an idea of how significant this technology, it not only became adopted by Providence, but it's been adopted throughout the U.S. CDC uses the chatbot, same type of chatbot technology, and it's also been deployed in over 550. I think it's closer to 600 million messages have been deployed across 26 countries. So global response is certainly looking at the way that these technologies have been deployed. And really excited to be a part of the team that's helping to lead some of that response.
Yeah, that's great to hear. I mean, going back in time, what is time anyway these days? But I remember when everything was unfolding with COVID and Seattle was really a hotspot. So that is good to hear. It was also interesting to hear you talk about handing off from the chatbot to the health system, because I understand that that's a pretty big deal with all the promise around AI. Oftentimes, they might be a great isolated solution, but not being connected to the broader healthcare system is a huge problem. So it was good to hear you mention that. Last but not least, I'd like to have Rob introduce himself. Rob, you invest in healthcare companies. You invest in Amwell, actually, for example, the company that we were just chatting with Ashima about. I'm curious, do you see yourself more as a backer of consumer-focused companies or of health system-focused companies? And I ask that because this panel is both about healthcare systems and about consumers. And if it's one or the other, can you tell me which one you view as more important?
Sure, Aaron. Thanks for the question, and great to be here. Rob Coppedge, and I do lead Echo Health Ventures, which is the investment arm of two Blue Cross Blue Shield plans. One on the West Coast, the Cambia Health Solutions plans in Washington, Oregon, Idaho, and Utah, and on the East Coast, Blue Cross North Carolina. And in those two companies, we have two of the health plans that are most focused on systemic transformation. One coming at it from the perspective of the providers need to shift to this pay-for-value type arrangement. And the Cambia market's focused highly on the consumer experience. So from where we sit, we don't think it's one versus the other. We think if you're actually in the business of investing in healthcare innovation, healthcare transformation, you've got to do both. There's two ends of the same telescope. The model historically has been developed through a collection of payment rules and cultural norms that have been set up that actually, I think, have led to the problems that we've been facing, and that you have to tackle both sides of that equation to be able to truly transform it. So we invest across the continuum.
Got it. I like that, two ends of the same telescope. That's really interesting. So as I said before, this panel is both about interoperability or data sharing, and it's also about the consumerization of healthcare. And I'd like to ask how each of you sees your role. Rob, you kind of already answered this question, but I'd love to hear how each of you sees your role as far as impacting not only health systems, but also consumers. David, why don't you start?
Yeah, this is an area where I think that if we don't figure out ways to make it easier for patients and consumers to be able to access technology, it really isn't going to be having the impact that we envisioned. I mean, we can even start with more generally with access to broadband. That is a major issue that we know that exists. There have been reports from the FCC that the number of people could exceed over 170 million people nationwide that need access to broadband. And the impact it's had during COVID in particular is increased that digital divide between those that have and have not. And if we do intend to develop a system, it has to be equitable, it has to be affordable, it has to be something that all of us can take advantage of. So, with that as sort of one component, Once we actually have the technologies in place, I think the next question is it usable? Is it something that is intuitive? Is it something that can be set up fairly easily? And is it something that people will want? A good example is a project that I helped co-lead with Kaiser Permanente, which involved taking an existing healthcare program, a cardiac rehabilitation program, which is today anywhere between a 6 to 8 week program, requires you to come in 3 times a week to do the exercises. And when we virtualized it, we put it on a smartwatch and allowed the choice to patients that you could either come in for those 6 to 8 weeks and basically do the program as traditionally designed, or we've taken the core elements of that and we put it on a smartwatch and you can do this instead. Now, the only caveat is you're actually going to have to wear it and you're going to have to do the instruction. But that said, the number of people that actually adopted this program and completed the program was incredible. We saw a jump from around 40% completion rate to about an 80%, so a near doubling. So we knew patients loved it, but it also had a great benefit. Now, one of the benefits is that this program, cardiac rehabilitation for patients that have just had a heart attack, has a number needed to treat of around 7 to 17. So that means for every 7 to 17 people that complete this program, you save a life. So it's incredible that more than half of the people aren't actually completing the program. And here, by simply doubling this, because you made it easier for them, you've ultimately improved their likelihood of surviving. And then the second was we measured readmissions. And we saw the readmission rate drop from 12% at baseline to less than 1%. And so, we're seeing, by making it easier for patients, by enabling them to do things that are much more consumer friendly, lifestyle compatible, things that are available anytime, anywhere for them, we can actually not only improve their experience, but we can lead to better health outcomes and lower cost.
That's really interesting, because I often conceptualize of this consumerization of healthcare as working almost in the opposite direction, like pivoting, turning the home into a site of care. And I guess that is sort of like what you're talking about. But now I'm thinking about just treating patients less as patients in an institution and more as, the same as like everyday consumers. That's really interesting.
One of the things that we're recognizing is that, while we oftentimes think of healthcare as being in the hospital or in the clinic, and those are the periodic visits that you have, about 80% of all the information that we know today that impacts your life is stuff that happens outside of those visits. And we're talking about your lifestyle activity, your sleep, the stress, all the environmental factors, social determinants of health. These are the factors that ultimately that we can capture, we can better analyze. And with AI, we should be able to become much more proactive in our interventions and much more comprehensive.
But Aaron, I would not let the story of the transfer of these technologies into patients' lives be one of technology evolution. It certainly has been. There certainly has been new technologies that are coming to market all the time. But we've had the capability of shifting care to a more consumer-centric, consumer-relevant environment for years. And the barriers to that, I would argue, are not technology. They're more cultural, and they're about how we pay for care. So there's been a lot we could do differently for a very long time. But it's only now, in the moment of crisis, during COVID, for example, that we're seeing some of those walls break down, and we're getting that push that we need to push care into an environment that's actually more relevant to the consumer. I'm glad for that, but I don't want to mistake that for a technology evolution. It's actually a cultural and financial evolution.
Right. I definitely want to get to that point in a minute. That's a really good point. Thanks for bringing it up. I wanted to give Ashima a chance also to chime in and answer kind of the question that I posed at the top.
Thank you, Aaron. I think I was going to go back. Like, I grew up in India, and when visit to a doctor meant handwritten notes, and we have long gone from that, and now we have EHRs. In the past 10 years, 94% of the health systems now leverage EHR. So from a consumer's perspective, we have stored there's a massive digital health library in the US, you can imagine. But how much of that information is used for betterment of consumer, not just in the moment of time, but think of scientific discovery. Think about advancing human health. We have so much wealth of data. And today, that consumer data, that patient data is pretty much locked up in different data silos. variety of different EHRs, variety of different platforms, different vendors. So when you talk about consumerism, there's a long-standing belief that a patient is, as David was saying, is not just in the EHR, but my lifestyle, my nutrition, but wealth of information about me that I have been going to my physician for past 10, 15, 20 years, that is buried in there. How do you make sense of it? And to me, today, when we talk about digital health, right, we talk about multiple apps. And I'll give you an example that I often give. There's an app for everything. There's an app for diabetes, an app for diet, nutrition, different disease types. And if you look into it, combined with Google and Apple App Store, there may be 200,000 plus apps. But now, when I ask you how many of apps really connect to a patient connected, what's the percentage? And that's like less than 2%. So by not having that interoperability and connecting the dot from consumer, we are actually scattering consumer data in multiple different apps. I call them like glassware. These are good experiences, but what we need is connected experience. And the connection will come through if that app knows about my medical history, it knows about my condition, my encounters, and have that time series, like what is Ashma's health and what's her journey. I think that will lead to better outcome. We all talk about the right intervention at the right time will lead to better outcomes. I think that's where we are at.
Yeah, that's really interesting and makes me think that I'd like to pose a somewhat controversial question. And you may have already sort of answered this with your explanation just now, but can health data even be interoperable? Are we solving potentially the wrong problem here?
I think healthcare data, there's two things, right? One is the data access. When I talk about interoperability, there's syntactic, semantic, and technical interoperability. So health data today, as we, multiple different EMRs, and that's why standards like FHIR are important, right? That part is interoperable. Because still healthcare has data in PDFs, it's in documents, it's in clinical unstructured notes. So I believe that's where the power of AI and machine learning comes in. Can we convert that data, which is unstructured, living in the faxes, living in the PDFs, and convert it from unstructured to structured, and then that can be interoperable. So today, a lot of progress from the clinical data set that's CMS and ONCs have defined. I think that data is interoperable. But as Rob was saying, one is the data interoperability, other is incentive. Do we want to make this data interoperable? Like two different questions.
Right.
Yeah. I think interoperability, you have to look at it from sort of the nuts and bolts of, are you actually having the data sets that allow you to be able to understand and combine them into different manners, and some of which is we already have structured data that's not interoperable. We need to figure out ways to make that more interoperable with some of the standards that we have today. There's unstructured, which certainly with NLP and other mechanisms to convert that to structured. But
natural
then
language processing.
I'm sorry, what was that?
NLP being natural language.
Oh, yes, I'm sorry, natural language processing. Yes.
I'm the jargon police.
One of the things that we run into, which we oftentimes forget, there is that fourth level of interoperability, which is at the system level, and it's about policy. And it's about allowing us to be able to understand how these different systems, these interoperability systems will play. Are we standardized on specific ones? And it really isn't until, everyone always says, I love standards because everyone has one. Well, what we need to do is we need to standardize on the single standard for how we make healthcare data interoperable, specific for particular types of data sets. And when we get to that point, when everyone agrees on this is the process for how it works, then we can get a functional system. Because right now, interoperability only works within certain types of ecosystems. We need to combine these ecosystems together to make it truly interoperable and holistic.
Yeah.
Yeah, and
Rob,
I just say,
go to you.
Yeah, thanks. This goes back to the point I was making earlier, but also maybe a little different take on it. Is that these walls between data have been built up over the years for some of the same reasons that we pointed to, which are that there weren't financial incentives in place to share. These systems have really never had a reason to want to let another system know what's going on with X, Y, or Z patient, X, Y, or Z consumer. It's not in their benefit to have the data organized around the consumer at their level. And you get down to it, I mean, that's happening now. The standards are driving us there. There's federal regulation that's driving us there. But what kind of interoperability absolutely matters to the consumer? And it is that they can walk in where they need to go and have the providers understand them, understand where they are in that care journey. I'd say a lot of that exists today, but the barriers to it are less about, they're less about the technology, and they're more about the fact that it's not been in anyone's best interest to help them along that journey, and they have not had the tools themselves to kind of carry that with them. I think technology is helping us get there, and I think there's some really interesting companies that are out there that have been tackling this. But I'd say it's not going to really change until the health systems kind of break through that barrier, that they can actually have a sustainable economic model that does not rely upon locking a patient in to their network, but kind of setting them free.
Right.
Just to add in there, I think Rob, the business models are changing. Like healthcare is moving from fee for service to value based. It's a journey. They are developing their roadmap. And when you go from fee for service to value based, now connecting that patient start, it becomes kind of business imperative as well. So 100% agree. I think misaligned incentives have played a large part in why the data silos exist today. That's why I think healthcare industry, again, having my Kaiser alma mater hat, industry works from the stick and a carrot. Where the carrot is better patient experience, connected experience, and meeting consumers where they are. The stick is now coming back from the CMS and ONC rules, and that's where we've been pretty passionate about supporting them. And the rules say like that by, I believe, from providers July 2022, and for payers by 2021 next year, patients will have access to their data. And they will have their access to their data by not a CD drive, not a flash drive, not a fax, by an API. And consumers like you and I will say, okay, geez, I don't need an API access to my data. But the promise is once you have an API, I can connect an app of my choice to my data electronically. I don't need to spend hours in FedEx and converting the CD drive into electronic data. So I think that's the essence of those interoperability rules, and we've been along with Microsoft, and like this is a cross-cloud industry-wide initiative to support this.
Yeah, when you put the patient in the center and you make it all about patient and consumer access to their data and allowing them to have access real time, I mean, in an electronic format that's exchanged. That allows us to be able to go beyond where we're at today, where one could say, oh, you have access, just wait 30 days or 60 days to get it back.
I do want to push back on that point a little bit, because I'm sure all of you remember, we had this little thing called a PHR, which was a patient health record. And I think Microsoft Health Vault, I think, was an example of this. There were plenty of others. And they no longer exist. They didn't really work out as planned. And so I'd love to hear what lessons we've learned from that failed experiment and how we might move forward from there.
Well, I think one of the first things that we have to recognize is that healthcare is a very unusual industry, because we only care about it when you actually need it. And then you expect it. And that means that when you actually do need it, you expect to have access to the information and the tools that are most valuable. And so, think about COVID. When so many people were being hospitalized, it was difficult for many persons to be able to go to that same hospital that they used to go to that had their medical records. They're coming into different facilities, and the doctors know nothing of these individuals. Sometimes they're coming in a very poor state. They're relying on histories and physicals from family members, or maybe they don't have anything. And this is an opportunity where we could, imagine a future where people, if they did have access when they needed it, to be able to deliver on these outcomes. In many ways, these are the things that we see when we're in times of crisis or when individuals need that information. What we also need to do, though, is we need to figure out ways to make it more than just simply during those times of emergency. How do we create value so if people actually had information to their medical record, that they could actually combine that and run and have programs that can help them every day to address some common issues like chronic disease. This allows us the opportunity to start thinking about how industry can start helping individuals once they actually have access to their data and not relying on other processes that are external. If the individual has access and they can control who has the ability to be able to run the programs on it, innovation will result in what we'll see as an opportunity for us to have new use cases and greater opportunities for value.
I would say,
yeah, go ahead.
I think tying this from the consumer's perspective, not as a new technology fad or a new, I think it needs to be meaningful in me, empowering me to manage my own health. I think as long as we can tie it, I think the prior effort, now we have seen a lot of people taking into wearables. These tools have the lower barrier to entry, and we should take that as a sign of enthusiasm, that if we make it easy, if we make it meaningful and empower them to take care of their own health, they would want access to the data. So I'll give you an example. If you're a diabetic, it's a lifelong journey to manage your condition, like pricking your finger 3 times a day, uploading it and seeing, talking to my nutritionist or my doctor and managing my medication. And you have to do that for a long, years. Could we do that? Could we create electronic digital therapeutics, so digital option for them to actually see that they can participate? I went to the birthday party. I should not have had the second cupcake because look, my reading spiked. So how do you empower them? I think that's where the meaningful intervention and empowering and giving these tools, and that's where they will need the data. But they will not just need the data for taking the data for the sake of it. I think that's where I believe there's the lower barrier to entry for this digital health application will be huge.
Since we're talking about, oh, sorry, go ahead, Rob.
No, I was just going to say, I couldn't agree more. I mean, you think I think I actually still have if those databases are still active, I still have accounts on both the old Health Vault system and the original Google, the Google record.
I might as well.
Yeah. And I think for avid hobbyists, they were great systems, but they were, to me, an example of what happens when you, and there's no offense to anyone on this call, because I think David and Ashima were not in their current jobs at the time, but see what happens when you have a big technology company trying to come in and say, we're going to solve this very specific healthcare challenge. And I think both Microsoft and Google have learned a lot since those days about how to do this differently and in a more relevant way. I look at the feelings of those early personal health records, and they weren't easy. The insights weren't that meaningful, and the data was not complete. And the onus to make them complete was always on the consumer, and we had no idea how to navigate them. New tools coming out now, I think, have learned a lot from those solutions and have improved greatly.
I think other thing to add, there is also the business model. Erin, like today, 86% is chronic condition spend. So you're not, yes, you're making the tools meaningful, but when we talk to the health system or the payers or the insurance companies, we all know the healthcare is already at 3.6, and I am hearing like 6 trillion by 2025. Our cost is going up. And if you look at 86% being chronic condition, so now there's an impetus from the business. So now you're tying this consumers' empowerment and them taking their own health, because it is going to impact and help with that trajectory just going upwards. Can we help, bend the curve for chronic condition? That's the opportunity both from the health perspective and also from the business perspective. So this is a good convergence, which was not there, if you ask me, like 10 years ago when the whole PHRs were there, right? So anything, there needs to be a business opportunity, there needs to be meaningful health intervention opportunity. I think that's where we are at a place where we should take this as a good sign that people want to be part of decision-making of their own health.
Yeah, we're talking a lot about wearables, which to me, reminds me a lot of another topic we're talking about at the same time, which is chronic conditions. Oftentimes wearables are designed, and you have Apple Watch with AFib detection capabilities to chronic condition. A lot of these diabetic monitoring technologies are also designed to monitor that, which is a chronic condition. And since we're talking about chronic conditions, I mean, we all know that because of systemic discrimination, we have systemic inequality, which has resulted in, an overburden of chronic illness on certain communities, most often communities that are low income, communities of color. And obviously, systemic inequality plays a really big role in healthcare. So how are you all thinking about equitable access to virtual care tools like these wearables that we're all talking about? And, what is the role of the cloud in helping to make those wearables more wearable, shall I say, more useful?
Well, I think the wearables themselves have matured in many ways, where it used to be about number of steps, and we kind of so focused on certain numbers per day. What we realized is steps was just the very beginning. We're seeing newer sensors being brought on, FDA cleared, an opportunity for us to be able to apply different aspects of the wearable, such as geofencing and personal emergency response systems. So
what is geofencing? Did you say geofencing?
Oh, yeah. So the geofencing in the sense that you can actually, when you're in a certain area, the individuals will know that you have gone past the boundaries. Terrific would be, a great use case would be if you have, let's say, a relative that's getting early Alzheimer's or, in dementia, where the concern of them wandering outside of a certain boundary would be something that you've got concerns about, and you can't always be there with that person to watch over them. Geofencing could allow you to be able to do certain things like that. So these newer capabilities, as well as of course, the reminders and all the other abilities to even use that as a phone, give us now a lot more use cases. And that then needs to then get translated into tools that can be made easier to use, that are specific for particular uses, and then are also affordable. What we've also seen is that some of these are really designed for the tech-savvy individuals, the folks that are, we'll call, the worried well, that want to get better because they want to look at the data. I don't think most of the people, if you look on a broader spectrum, are in that category. Most of them are trying to solve a problem. They're trying to solve a need. So if you were to take a typical senior, for instance, they're part of the folks who I would say, when you think about disparities of care and access, they don't necessarily have access or even a desire to leverage some of the existing tools. But if you put it in a position of, well, you can wear this and then you can live independently at home, that's a different value proposition than what we were talking about before, as opposed to tracking your health, where now we're talking about an ability to do something that's so meaningful to them. The independence and ability to live at home by using all the different tools that we talked about gives them confidence, gives their caregivers confidence, and ultimately allows them to be able to stay where they want to. And I think that's where we need to start taking technology to really take it from the perspective of what is the key issue, the value that you're creating, and then allow us to be able to deploy it in that context.
Right. So like starting with problems and iterating from there rather than a more top-down kind of approach.
Yeah, and then don't expect that everyone's going to take the data and find immediate value out of it. I think there are certain individuals that will, and maybe the companies that can take that and then draw the insights, which can then provide value to the folks. But the data themselves are almost like an ingredient. If you're baking a cake, people don't necessarily want to see all the flour and the eggs and everything. That they want to see the cake and they want to see the end result. And really, that's where technology companies can come in, and we can help make it easier. We can streamline that process. We can pull it all in. We can normalize it. We can make it into a format that they can understand, and then ultimately present it at the right time.
I think there is one underlying problem, Erin. I think today, and I forget the percentage, a lot of people living in rural communities do not have access to broadband. So there is a divide, and we need to acknowledge that there is a digital divide, and it will only grow because many industries, not just healthcare, are now during COVID or post-pandemic, there's a digital pivot. There's a digital pivot when you're shopping. There's a digital pivot for groceries. There's a digital pivot for healthcare. How do you bring those communities along? I think I was discussing with some esteemed group yesterday. There's on Moon, I was reading NASA is launching 4G network, right? So we can do that on Moon, we can do it on Earth. And I'm not simplifying the problem. All I'm saying is there needs to be that focus. We need to bridge that digital divide. Otherwise, these capabilities will become truly very limited to the urban areas with broadband. And we have seen with COVID-19, we've seen it expose the vulnerability in the health system. So people with a certain socioeconomic status have had a profound impact on the outcome. So I think it's incumbent upon everyone, entire ecosystem, tech companies, health systems, telecom companies, like governments. I think we need to have an answer for that. I think from the technology perspective, the only thing I'll say is as we are building this digital foundation for the future or enabling our customers build this foundation for the future, we need to account for that architecture where we are able to make it easy to connect social determinants data. Can we bring different data sets in an easy way so that as you're building the next generation applications, and we are kind of lowering the barrier to include them. Today is pretty hard. Like data, census data is someplace. So this just pretty hard to, it's easier said than done to bring it into your architecture and design. And I think that's incumbent on us. But overall, there's simple solutions. So post AMVAL announcement, I happened to talk to maybe 70 plus different CIOs, like what does the, as I'm looking into next generation product and solutions. And I was thinking, and more AI machine learning, the first request that was broadband. Help me understand which setting for which people. I think, and can you make it just phone only? Like if video is not working. So there's a pretty humbling requirements that are coming like today in making that and helping with that digital divide.
Yeah, on the topic of broadband, a couple of years ago, Microsoft launched an initiative called Airband, which was designed to offer originally 2 million. We expanded to 3 million individuals across the country access to broadband. And part of that was done because of some early FCC reports that the number of people that needed broadband was around 23, 24 million. But it turns out that with further subsequent studies by the Pew Institute, they realized the number is closer to 175 million. But with the learnings that we had during that time period, and we're still in the process of implementing Airband, are that one, that we have as an opportunity to partner with some of the key individuals, the key organizations. Without those partnerships, and we're talking about telecom, we're talking about device manufacturers, we can't create the infrastructure that's necessary in a lot of these areas. The second is that the devices themselves have to actually get cheaper, more affordable. We started at the initial start of the project, the average cost per one of the devices was around $800. But through the partnerships and through all the streamlining, we were able to bring it down to $300. So it's an incredible benefit now that we're starting to see because these partnerships are forming. And then the third is around the funding and the infrastructure, both at the state and the federal levels. And we need to continue to see greater emphasis and focus on that. And that's part of the reason why, when we look at these problems, they're oftentimes pretty large and no one company can solve it. But what we have done is we have uncovered some of the issues that are present that we need to address, both from a policy standpoint, but as well as from a partnership standpoint.
Yeah. It makes me think my question about the role of the cloud there, being high up in the ether somewhere is a little silly because you got to start with foundations first, giving people access to broadband, for example. That is incredibly important.
Devices that will be able to use and view the things on it. But once you got the basics in place, then the cloud enables us to be able to go pretty broadly across entire area of geography.
Okay. Yeah. Rob, I think you're on mute.
Sorry, Aaron. Thank you.
No problem.
I just say there's lots to be optimistic about though here, and that you look at during this pandemic, We have portfolio companies that are dealing with substance abuse issues, portfolios that are dealing with Medicaid populations in inner cities. They have leaned on some of these technology-driven solutions and digital health solutions to get care to people during a pandemic, which they otherwise could not. And so that gives me optimism. But what Ashima points out about rural health is probably the largest challenge that I don't yet know of a novel or sort of a scalable solution for, which is how do we get access to that last mile, those care deserts that are there in all the states we live in, especially here in the Northwest. And so for those of you who are on this call who are listening and trying to think about where do you start your next business, where do you drive your innovation next in your company, if folks have opportunities or see ways to scale care either directly or through technology in these rural communities where access is very limited, taking advantage of the tools that are there that now serve folks who need access in cities and suburban areas, that's a place where there's a huge business opportunity and currently unmet, but either by technology or by services.
Got it. I also want to bring up another point that has been, coming up in the back of my mind as we talk about this, and I imagine for our audience here, it's probably a question that they're thinking about too, which is patient privacy. I imagine the cloud presents both lots of opportunities to better protect patient privacy, but also some challenges. How are you all thinking through those opportunities and challenges?
And both security and privacy are top concern, especially when you talk about healthcare and PHI. Healthcare data tends to be very sensitive and rightfully so. So from cloud perspective in GCP, in Google, we think about security and privacy very deeply at every step of the way. Cloud presents zero trust model. And it's that focus on security and privacy that enables us to innovate in healthcare. For example, we have not just industry-leading cybersecurity practices. We, of course, comply to HIPAA, GDPR, the other regulations out there. But when you're building on top of that, for example, de-identification of patients, like being able to give that, we have DID API where if you have a chest X-ray and if you look into that image on the right-hand side, there's the PAI like embossed on that. Even when we talk about healthcare data, which is FHIR, can we take it out so people feel comfortable putting the data in the cloud? But it's not just about giving the tooling. We have to, as a cloud vendor, abide to these trust principles, and we have publicly gone on record. Especially from the Google's perspective, there's that tech perception, and we want to address it very strongly head on. We give the customers full control on who access their data. It's like putting the data in a vault, and they can have the key, and only they'll look at it. They can encrypt it. And there's a new innovation of confidential computing where even when it's processing, it's encrypted. And then, and we never combine the data. And this is a unique problem or a concern that people have for Google is, are you combining that with your advertisement business? No. Right. Google Cloud is a completely different set of business, and we absolutely, resoundingly, the answer is no. We do not do that, and we can't do it if we need to be in this business. And so it's a top-level concern, top-level OKR for the entire company from the privacy perspective, like Sundar on down.
One of the things that we've seen over the past decade, and more recently with even the past 5 years, is a level of maturation and sophistication of the cloud capabilities around security and privacy and data protection. The capabilities within the cloud surpass the capabilities now on-prem in many capacities. I mean, just think about one of the most basic of just protection against attacks. These attacks are come in many different formats. You need to constantly update your software. You need to constantly have these, to do that real time when you learn about these different ways. That's what cloud enables us to do. We can do things real time. We can do it at scale, as opposed to the current processes, which in many cases require a significant amount of effort to be able to do that in a delay, and then to be able to push that out to all the different devices. And this is what cloud allows us to be able to do. And that is the reason why cloud has been adopted by so many of the regulated industries. Healthcare just tends to be a little slower relative to the adoption, but that's largely because of the fact that it did take some time for this capability to mature. But today, cloud is actually probably one of the most secure mechanisms for us to be able to handle data and security because of the fact that it is scalable, it's nimble, it allows us to be able to act quickly, and it allows us to be able to leverage the newer technologies that we have in place.
I think that's where David brings up a good point, the democratization of the infrastructure to the industry. So the same infrastructure that powers Google's products, the privacy and security, is now available to the industry. And you get those economies of scale when you're using a cloud vendor, because we have invested deeply in creating those data centers around the globe. And that's like bread and butter from the infrastructure perspective. And David, you're right. I believe the last I checked, it was $300 billion per year security breaches just in healthcare. Right? So here in the cloud, we provide that pathway that, yes, you are benefiting from the investments that cloud vendors have made for their own businesses across many different industries, and you get the same benefit of years of investment in both engineering and product in securing the infrastructure. And then privacy, I already kind of responded. We abide by not just the industry regulations, but also as independent auditors. So people should, I think that awareness needs to be there, that I think we need to do a better job in disseminating that information today, that yes, they should feel assured these are principled conversation and we have those trust principles in place.
I did want to follow up just briefly about that de-identified data piece, because, from my end, having written about that, I know there's a lot of concern around, and there has been for a couple of years now, around this idea that once you have your identifiers, your name, age, those sorts of things removed, there's kind of no way to guarantee that won't be re-identified. And Ashima, you were talking about, potentially doing that by combining with which you said Google, absolutely does not do. I'd just like to hear more about how you approach de-identified data, how you keep it secure and safe.
So de-identification today from cloud perspective is available as an API. So we give that as a tool. That way you can take all those 18 identifiers, you can strip them out. Right. And when you're using the DID, you're using it in your own Google Cloud environment. So the data at no point is leaving your bucket. We call it bucket as a technical term. Excuse me for using that. But so cloud is like a big hotel. You get your room and you have the only key. You're in there, and we're giving you a tool. You're de-identifying that, and then a lot of our customers are also doing their own third-party verifications as well. They bring in their own consultants to see what are our DID practices. And so where we stop from the tools and the platform perspective, when our customers are using it, they bring in their own experts to say, how is it being stored? As I mentioned, there's audits, there's full trail, there's full transparency. It's called AXT. Access transparency, meaning at any point you would know. That's not Ashima saying that no one has access. There's an access transparency logs. People can look into auditing and see who has access to it. And customers control it. So pretty much the data is their data in their environment. And these are the tools that are available to them.
Okay, I'm just doing a brief time check. It looks like we're almost out of time already. Thank you all so much for this. Has been a really lively and I think pretty educational discussion. I appreciate the time, and it's been a privilege to be able to sit and take some time with you all. Before we go, though, I did want to ask one last question, and that is because we are in the middle of what everyone here tuning in and everyone in this virtual room is probably intimately aware of. It's the middle of a global pandemic. It's a pretty unprecedented time. And I'd love to hear what is inspiring each of you right now. What's giving you hope amid all the crazy that's out there?
Maybe I'll go. Oh, go ahead.
Sure, I'm happy to go first. I just say, I've been doing this for 20-something years and have made my share of slide decks that talk about aspirational ideas, and being in venture is not a very, there's a lot of ego in the center of that. And I'd say the best part of the past few months has been how we've refocused the conversation on the folks who deliver care and the folks who need care. And that has changed the discussion in boardrooms. It's changed the discussion inside of some of our portfolio companies and certainly among our peer organizations. And that gives me some hope that we can come out of this and keep the focus in the right place and not going back to where it was previously.
During a time of crisis, sometimes people do things that go beyond what they normally do. And when you see that being done every single day, whether it's healthcare workers putting themselves at risk, frontline workers being able to put themselves at risk, and then where we have seen, I'd say, some very extraordinary partnerships between folks that are non-traditional partners come together to develop technologies and solutions and platforms. Microsoft's been involved in several where we have worked closely with partners that never would even talk to each other before. They were, not really considered, partners. But in the setting of COVID, there's a recognition that we all have a role to play. One of my colleagues put it best. When we got into that room, we took off our badges and our name tags and our logos, and we were all one team. It was pretty inspiring to see how we all banded together to help address this need for not only our own individuals or our companies, but really for the nation and for the globe. And that's inspiring. It gives me hope that we will do the right thing, and we will do it in a way that is very collaborative and leverages the ability and skills of everyone that we have available.
Yeah, and I would say that we're still in the throes of dealing with the pandemic, so hope can sometimes feel hard to come by. 2020 has been that year. But I'll tell you, past few months, I've been home a lot and spending a lot of time with my own daughters and listening to them and seeing them respond to both political, economical, and this whole pandemic environment. And we've seen a lot, the Black Lives Matter, the climate change, and the courage and clarity and convictions these kids have. It's pretty inspiring. Like I go back, if I had that level of conviction and clarity when I was as old as they are now, so that tells me that these youngsters will conquer the next decade in making the world a better place. They truly are very passionate about it, and how they are into and having courage, conviction, and also clarity at that young age is something pretty inspiring to me. And I see them not just with my own daughters, their friends. It makes me feel like we'll be okay in the long run. Like we're leaving it in a good hands. So that's pretty inspiring to me to see these interactions and the little movements they have.
Well, that is extremely good to hear. I very much hope that is the case. 2020 has definitely been a doozy. But again, thank you to our audience for joining us. Thank you to GeekWire SUMMIT for putting this on. And thank you to all of our great panelists. This has been a really fun session. So thanks.
Thanks, Aaron, Rob, David, and Ashima. And once again, thanks to our partners at Regents for their support of the health tech stage here at the Summit. Now coming up in just a moment, our final fireside chat from the Bank of America stage, an exclusive interview with Mike Sievert, the CEO of T-Mobile.